Have you ever heard of a way how to avoid a heart attack that no cardiologist ever talks about? The truth is, 78% of people who suffer a heart attack have one thing in common: a problem hidden inside the mouth. Not cholesterol, not obesity, but a silently infected tooth. No pain, no swelling, no bleeding. And what's even scarier, many only find out after their first heart attack. At the end of this video, I'll show you a simple check that could help you avoid a stopped heart before it's too late. You may not feel anything at all. No toothache, no swollen gums, no bleeding. But right beneath what seems like a normal tooth, there could be a silent infection. And it's quietly sending bacteria directly into your cardiovascular system every day. This is not just theory. A study quoted from the book by Dr. Thomas Levy revealed, in 78% of patients with myocardial infarction, researchers found bacterial DNA from root canal-treated teeth. Do you know why? When we perform a root canal, the dentist removes the dead pulp from the tooth, cleans it, and seals it. But tooth structure is very complex, with thousands of tiny tubes called tubules. During the cleaning process, many of these still harbor bacteria. And then day by day, as you chew, speak, or move your jaw, these bacteria can be pushed deep into the bloodstream, traveling to the heart. Certain bacteria release toxins that inflame blood vessels. Vascular inflammation is the beginning of a dangerous chain reaction: atherosclerotic plaque, blood clots, and eventually heart attack, a sudden cardiac event. So if you've ever asked how to avoid a heart attack, you probably never imagined that the answer might be inside your mouth. In the next part, I'll share a true story, how I personally discovered an invisible infection under my tooth, and how it forever changed the way I view heart health. I want to tell you a story. It might even be your story, or someone you love. Not long ago, I went for a routine dental checkup. Nothing serious, no pain, no cavities, no gum inflammation. But the dentist suggested a 3D cone beam scan for a deeper look, and that's when I discovered something that gave me chills. Right under a previously root canal-treated tooth appeared a dark circular area, a sign of silent infection. No symptoms, no warning, but clearly an active abscess. The dentist said, "This may have been here for years. If left untreated, it could affect not only your jawbone, but may also be a risk factor for your heart." I was stunned, because right then I remembered a study I read just weeks earlier. 78% of heart attack patients had bacteria from root canal-treated teeth. Source: Dr. Thomas Levy, a renowned cardiologist in the U.S. It didn't stop there. Many studies also found DNA from oral bacteria in blood clots that caused strokes. They call this phenomenon leaky mouth syndrome, a condition where the mouth leaks bacteria into the bloodstream. And you know what? After I decided to have that tooth extracted, something unexpected happened. The chronic neck and shoulder pain I'd lived with for months almost completely disappeared. No medication, no massage, just the removal of what seemed like a harmless infection. That was the moment I realized. We take care of our heart with pills, with diet, with exercise, but we forget the dirtiest place on our body, the mouth. And that was when I became truly serious about finding out, how can we detect infections early? What should we do when we suspect a tooth infection? And is there a way to prevent a heart attack from this unusual perspective? A lot of people think, I don't have a toothache, so how could I have an infection? But the truth is, infections beneath the tooth, especially after a root canal, often cause no clear pain at all. It's like a silent biological bomb. Here are some common signs, often overlooked, that may indicate you're carrying a silent tooth infection, and it could be affecting your heart health. Tooth: 1. You've had a root canal but haven't checked it in years. A root canal doesn't mean all done. Bacteria can survive in tiny tubules and regrow over time. If you had a root canal more than 5 years ago and never had follow-up dental imaging, be cautious. 2. Chronic fatigue, mild pain in the neck, shoulders, upper back. Do you often feel a stiff neck, heavy head, or soreness in the upper back for no clear reason? In some cases, silent tooth infections trigger low-grade inflammation that spreads, causing pain in distant areas like the neck or upper back. 3. Bad breath despite good hygiene. Mild but unusual smelling breath. Not like food odor, more like a strange metallic or musty scent. This could be a sign of deep infection under the gums or in the jawbone. 4. Loose-feeling tooth or chewing imbalance. If one side of your jaw feels off or unstable when chewing, or you always tend to chew on one side, you should get it checked. Your body may be unconsciously avoiding an inflamed area you're not even aware of. 5. You've had a heart attack, stroke, or high blood pressure without a clear root cause. Especially if your cholesterol or blood sugar levels aren't particularly bad, you should seriously consider that the inflammation may be coming from your mouth. If you suspect you have a tooth with infection, the first thing to do is not to buy medicine, but to get properly checked. 1. Scan with 3D cone beam CT, not regular X-rays. Small abscesses deep below the tooth root are often missed on regular X-rays. Cone beam CT, CBCT, is a 3D imaging technique that allows the dentist to clearly view the jawbone and tissues around the root, the exact places where infections often hide. This technology is extremely valuable, especially for people who've had root canals, crowns, or dental bridges. 2. Do a blood test, C-reactive protein, CRP. CRP is a marker of systemic inflammation. If you have a silent tooth infection, your body still reacts by raising CRP levels, even without fever or pain. High CRP is also an early warning sign of heart attack and stroke risk. 3. How to treat it if a tooth infection is found. If your dentist confirms a tooth infection, treatment depends on the situation. Tooth infection antibiotics. If the infection hasn't spread too far, your doctor may prescribe antibiotics to control the infection. Root canal retreatment or tooth extraction. For long-treated root canal teeth with deep infection into the bone, the most effective solution may be extraction to prevent bacterial spread. Warning, important note. Do not self-medicate with antibiotics. Self-prescribing can mask symptoms, cause antibiotic resistance, and make future treatment more complicated. In summary, don't wait until you feel pain. A silent tooth infection may cause no pain, but it can damage your blood vessels, your heart, and your entire immune system. And if you find yourself with at least 2 of the signs mentioned above, stay with this video until the end, because the next part will show you how to check, treat, and resolve a tooth infection before it leads to serious consequences for your heart. If you're looking for how to prevent the heart attack in a sustainable way, understand this. Prevention doesn't begin in the hospital. It begins right at home. Not just with medication, but with small habits, repeated every single day. Use liposomal vitamin C. This form absorbs better into your cells and helps reduce oxidative stress, a key contributor to artery damage. 3. Sleep well and manage stress. Your heart needs rest. Lack of sleep and chronic stress are 2 hidden culprits behind high blood pressure, cholesterol, and increased stroke risk. Getting just 7 to 8 hours of sleep each night can reduce heart attack risk by 20 to 30% without a single extra pill. 4. Move regularly. No need to overdo it. A brisk walk for 30 minutes a day, 5 days a week, is enough to improve blood vessel function and strengthen your heart. Don't try to compete with your youth through intense, heavy workouts. That can backfire, especially if you've been inactive. Remember, how to prevent the heart attack isn't about waiting until pain strikes. It's about choosing to live, not leave it to chance, every day. And sometimes, by simply checking one tooth, you might avoid a heart that suddenly stops beating. In the final part, I'll share with you a simple checklist that will help you evaluate whether you're carrying hidden risk and if it's time to act. Sometimes, just one checkup could save you from an unexpected heart attack. If you have 2 or more of the following signs, take your oral health seriously and schedule a dental checkup, especially a cone beam CT scan, as soon as possible. Point 1. You had a root canal more than 3 years ago. Even without pain, a root canal-treated tooth is still at risk of reinfection. The risk is higher if you've never had a 3D scan since the procedure. Point 2. You experience chronic fatigue or unexplained neck, shoulder, upper back pain. It's not from aging or bad posture. Hidden inflammation could be affecting your immune system and even your blood vessels. Point 3. You have unusual breath odor or uneven chewing. Persistent bad breath that doesn't go away despite good hygiene? A side of your jaw feels off or awkward while chewing? That could be a small infection deep under the tooth root. Point 4. You've had high blood pressure, high cholesterol, or even a heart attack, but with no clear root cause. Many doctors focus only on the heart and forget to look in the mouth. Oral inflammation could be a root cause that was overlooked. Point 5. You have a family member who suffered a heart attack or stroke, especially under age 60. Don't wait for symptoms to appear. Genetics plus silent inflammation equals a dangerous combo. Dart message, final message. If you saw yourself on this list, do this one simple thing today. Call your dentist. Schedule a cone beam CT scan or have the area checked where you had a previous root canal. And if signs of infection are found, follow the advice carefully. It may only require tooth infection antibiotics or a more decisive treatment before it's too late. And if this video helped you see heart health from a new perspective, share it with someone you care about. Because who knows, you might be saving the heart of someone you love.